Right now, somewhere in the world, a doctor is washing their hands before touching a patient. They don't think about it. It's automatic. It's obvious. It is also, historically speaking, one of the most controversial ideas a doctor has ever proposed. In 1847, a doctor figured out that washing your hands before surgery could save thousands of lives. He was right. His colleagues called him insane. They mocked him. They destroyed his career. They eventually had him committed to an insane asylum, where he died from an infection, the exact thing he had spent his entire life trying to prevent. His name was Ignaz Semmelweis. And this is the story of how being right was the worst thing that ever happened to him. Before we get to what Semmelweis discovered, you need to understand exactly how bad hospitals were in 1847. And I promise you, it's worse than you think. In 1847, if you were a pregnant woman checking into a Vienna hospital to give birth, you had roughly a 1 in 10 chance of dying within days of delivery. Not from childbirth itself, from something called childbed fever, a mysterious illness that would strike healthy new mothers within 48 to 72 hours of giving birth. Fever, abdominal pain, and then, all too often, death. Doctors at the time had no idea what caused it. Some blamed bad air. Some blamed the mother's emotional state. Some blamed cosmic forces. One doctor genuinely believed it was caused by embarrassment. Nobody, and this is the important part, nobody considered that the problem might be the doctors themselves. Because in 1847, doctors did not wash their hands, not before surgery, not before delivering a baby, not after performing an autopsy and walking straight into the maternity ward. Why would they? Nobody understood that invisible things could make you sick. The idea of germs didn't exist yet. Here's where the story gets genuinely strange. There were 2 maternity clinics right next door to each other, and one of them was killing 3 times more mothers than the other. Nobody could explain why. Ignaz Semmelweis was a young doctor working at Vienna General Hospital. The hospital had 2 separate maternity clinics. Clinic 1 was staffed by doctors and medical students. Clinic 2 was staffed by midwives. And the death rate between these 2 clinics was not close. Clinic 1, the one with doctors, had a death rate sometimes as high as nearly 20%. Clinic 2, the one with midwives, had a death rate closer to 2%. Word spread through Vienna. Pregnant women began begging, literally begging, to be admitted to Clinic 2. Some women chose to give birth in the street, rather than be admitted to Clinic 1. Think about how insane that is. Women were so terrified of the doctor's clinic that giving birth on the pavement seemed like the safer option. Semmelweis became obsessed with figuring out why. What were the doctors doing differently than the midwives? The answer came from the worst possible source, the death of Semmelweis's own friend. And once he saw it, he couldn't unsee it. In 1847, a colleague of Semmelweis, a fellow doctor named Jakob Kolechka, was performing an autopsy. During the procedure, a student accidentally cut him with the same scalpel being used on the corpse. Days later, Kolechka developed a fever, then abdominal pain. Then the exact same symptoms that were killing mothers in the maternity ward. He died. When Semmelweis examined his friend's body, he found something disturbing. The internal damage looked almost identical to the damage found in the women who had died of childbed fever. And then Semmelweis had the thought that would change medical history. What if his friend hadn't died from an unrelated illness? What if he had died from the exact same thing that was killing the mothers? Some invisible particle, something on the scalpel, something transferred from dead bodies to living patients. He looked at his own hands. He looked at the hands of every doctor in Clinic 1, the same doctors who performed autopsies in the morning and delivered babies in the afternoon, without washing their hands in between. What Semmelweis did next is so simple it sounds almost too obvious to be a discovery. But it worked instantly, and the results should have made him famous. Semmelweis ordered every doctor and student in Clinic 1 to wash their hands with a chlorinated lime solution before examining patients. Not just water. A solution strong enough to remove the smell of decay that lingered on their hands after autopsies. The doctors thought this was ridiculous, insulting even. They were gentlemen, educated men. The idea that their hands could carry something deadly felt like an attack on their professional dignity. But Semmelweis insisted, and the results were almost immediate. Within months, the death rate in Clinic 1 dropped from nearly 18% to under 2%. It matched the midwife's clinic. For the first time, Semmelweis had actual proof hand-washing saved lives. This should have been the greatest medical breakthrough of the century. Instead, it became the beginning of his destruction. Here's the part of the story that should make you furious. Semmelweis had the data, he had the proof, and the medical community rejected him anyway. You would think doctors, people dedicated to saving lives, would have celebrated this discovery. They did not. Semmelweis couldn't explain why washing hands worked. Germ theory hadn't been developed yet. He just knew that it did work, based on overwhelming data. But the medical establishment of Vienna wanted a theory, not just results, and many senior doctors were deeply offended by the implication. Semmelweis was essentially telling them that their own hands had been killing patients for years. Some colleagues mocked him publicly. Others ignored his findings entirely. The most painful insult of all came from his own mentor, who refused to support him and eventually pushed him out of the hospital altogether. Semmelweis became increasingly desperate. He began writing furious, accusatory letters to doctors across Europe, calling them murderers for refusing to wash their hands. He wasn't wrong, but he was no longer being heard. He was being written off as unstable. What happened to Semmelweis next is one of history's cruelest ironies, and it will make the ending of this story almost impossible to watch. By the 1860s, Semmelweis's mental health had deteriorated significantly. Years of rejection, isolation, and watching preventable deaths continue while doctors ignored him had taken a brutal toll. In 1865, his colleagues tricked him into visiting an asylum under false pretenses. When he realized what was happening, he tried to leave. He was forcibly restrained. He was placed in a straitjacket. He was beaten by guards. 2 weeks later, Ignaz Semmelweis died. The cause of death? A gangrenous wound, likely from the injuries sustained during his restraint, which became infected, the exact kind of infection he had spent his entire career trying to prevent. Killed the one man who had figured out how to stop it. Here's what happened after he died, and it's the only part of this story that comes close to justice. Years after Semmelweis's death, a scientist named Louis Pasteur proved the existence of germs. Suddenly, everything Semmelweis had argued made perfect scientific sense. Hand washing became standard practice in hospitals worldwide. Today, every surgeon, every nurse, every doctor on earth washes their hands before touching a patient. It is one of the most basic rules in all of medicine. There's even a name for the experience of being right and being punished for it anyway. Psychologists call it the Semmelweis reflex, the tendency for people to reject new evidence simply because it contradicts what they already believe. The next time someone tells you an idea is too obvious to be true, remember the man who was locked away for being right about something as simple as washing your hands. His name was Ignaz Semmelweis. Now you know what he did.